started. Welcome to the webinar this morning, Health Literacy, a Key to Patient-Centered Communication. I'm going to share just a couple of things with everybody before I turn things over to our presenter today. So everyone is on mute for today's webinar, but we do welcome your questions. So at any point, if there is something you want to share or a question you have, please feel free to write in using the questions pane on the GoToWebinar control panel. No need to wait until we officially call for questions. You can submit those at any point during the presentation. There'll also be a couple of poll questions that we'll ask you to weigh in on. So make sure that you're paying attention and looking out for those. Just a little test to see if you've had your coffee this morning and if you're paying attention. So this webinar is hosted by the Patient-Centered Primary Care Institute, which is a program launched in 2012 with the support of the Oregon Health Authority and managed by QCOR. Together with the experts that we partner with, like Claire from OPCA that we're going to hear from today, our goal is to get technical assistance, information, and resources out to practices working on the medical home or PCPCH model of care. We hope that our web-based and in-person resources are useful to practices that are at all stages of primary care transformation, from people just exploring the PCPCH program to those who have been working on PCPCH for a long time. We know it's a journey, not a destination, so we hope that there are a lot of helpful resources out there for everybody. If you haven't been to our website, you should do that. It is pcpci.org, and that's where you can access resources, including previous webinars like this one, and on a variety of other topics. So like I said, the PCPCH program is a really important partner in the Institute. The PCPCH model is defined by 6 core attributes, and within those attributes there are 33 standards that practices can attest to become recognized as a patient-centered primary care home by the state. You can learn more about the PCPCH program and those standards by visiting primarycarehomes.oregon.gov. And I am very pleased to introduce our presenter today. Claire is the Training and Development Manager at Oregon Primary Care Association. She's been working with primary care practices in Oregon for 15 years, has a master's in public administration with a focus on health administration from Portland State University. At OPCA, she's been leading clinics in their outreach and enrollment efforts, as well as in patient-centered communication. While with OPCA, she has developed her knowledge of health literacy and many other patient-centered communication concepts and techniques. She's delivered many in-person and online trainings to community health centers around the state and loves working with clinic staff to increase their knowledge and effectiveness. Claire is a wonderful resource and wealth of information on this topic, and I'm happy to turn things over to her.
Well, good morning. Thank you all for having me on this webinar today and for taking some time out to learn a bit more about health literacy. So you can see a picture of me here, but I thought I would do something even fancier and show you me in person so I could make this webinar even slightly more interactive than webinars usually are. So good morning, everyone. Let's go ahead and get started. So over the past year, I have been working with on the PCPCI collaborative with a number of clinics, and the focus of the collaborative was patient-centered communications. And so in that collaborative, one of the main focus areas was health literacy. It was a nice opportunity for a number of clinics to be introduced to health literacy for the very first time, and I'd like to say it was one of those areas that clinics were able to make some immediate improvements in once they went back to their clinics after a learning session. And so I am hoping that after this webinar, all of you who are on will feel equipped to go back and make some improvements right away in your practices. The learning objectives for today, which I have up in front of you, are to understand the impact of health literacy on successful communication and health outcomes, for you to consider ways to assess health literacy within your organization and during individual client interactions, and to learn about the tools and techniques you can use to have successful communication. There's a lot of tools and techniques out there. We'll just cover a few of them today. All right. So, oops, went too fast. Just a quick note of the standards that this addresses. Health literacy addresses actually a number of the standards in the PCH recognition, but comprehensive whole person care and person and family-centered care are those that I called out. Of note, to those of you who may be looking for national accreditation for PCMH, there are a number of documents, particularly from the AHRQ, who creates the Universal Precautions Toolkit, which I will address later. There are crosswalks to show you what standards can be addressed through health literacy, and that may be helpful to some of you who are pursuing national accreditation through NCQA or the Joint Commission. So quickly to review our agenda, I like to start meetings with a little bit of time to reflect. Then we'll talk about what health literacy is, so some definitions and impacts of health literacy. Then we'll talk a little bit about how health literate are your patients as well as your organization. Communicating well, that will be an opportunity to talk about some of the tools and techniques that you can use to ensure effective communication. Then we will be sure to save a little bit of time for questions, and then finally at the very end there is a resource list. All right, so here is the reflection for today. The curse of knowledge. Oh, what just happened? Hang on. The curse of technology. There we go. So the curse of knowledge. Once we know something, we find it hard to imagine what it was like to not know it. This is an opportunity for you, if you would like to try out your chat box, since this is a listen-only mode and I can only get feedback from you via the chat box. Does anybody have thoughts after reading this, or some ideas as to how this might apply to thinking about health literacy?
And this is Kate. Remember, you can write in on your chat or on the questions pane of the GoToWebinar control panel, and I'm happy to read what you have to share aloud to Claire. Someone said, it is hard to change. And someone else said, it's easy to forget what it's like to be someone else. And someone else says, it sounds like how health professionals might interpret how patients receive health information. Someone else offered, you may assume others know what you know. Someone else said they also like this quote and makes them think of the quote, we don't know what we don't know. And someone else offered to know something's not the same as to hear something.
Great. Well, those are all great comments and thoughts, and definitely what this makes me think of is that we as healthcare professionals, people working in the industry, we're surrounded by the knowledge and context of what's going on in healthcare. And so when we interact with folks who don't have that context and don't have that knowledge, it's hard for us to put ourselves in their shoes because we already know what we're talking about and what's going on. And so I think health literacy, as we talk more about it, is an awareness that not everyone does understand and have the context that we do. And so how can we help folks better understand what it is we're talking about? All right. Thank you guys for taking a moment to reflect with me. So just to ground us a little bit on health literacy, we all like definitions. So this is a definition, the first piece up here, that comes from HHS, the Health and Human Services, their Healthy People 2010, which was published in 2000. though I guess we're already past that. But this is where this original definition came from, and it is that health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. And then somebody took a nice health literacy lens to that definition and said, simply stated, health literacy is the ability to find what I need, understand what I find, use what I find to meet my health needs. When we talk about literacy, we often think about written word. When we're talking about health literacy, we're talking about written and spoken or oral communication. So I think that's important to realize. It's your written materials as well as your oral presentation. All right. I would love to acknowledge for a moment the people who have been my teachers around health literacy. It is not a subject that I've been an expert on for years, but I have had teachers who have been working in health literacy for a long time. So the first is Lori Francis. She is my colleague here at OPCA, the Oregon Primary Care Association, and she has for many years sat on the Institute of Medicine Roundtable on Health Literacy. And she came to us from a federally qualified health center in Montana, which is actually the next group here, the Community Health Partners in Montana, and they have set up a whole health literacy program in their clinic, as well as a literacy program, because they realized that many people just need to learn how to read as well as to have health literacy. So Lori Francis has always had an amazing focus on this topic and has taught me much about it. Then there's Cassie Burns, who comes from Community Health Partners in Montana that I was just mentioning. And during our learning collaborative for PCPCI, she came out and trained me, as well as a number of primary care clinics, on what health literacy is, and particularly how you might go about training and creating awareness among staff in your clinic. So a little bit less of a focus on how to assess it in clients, but more about how to make folks within your own practices aware of this and how to be better communicators. And then finally, I would like to acknowledge Legacy Health. I had the opportunity to attend their most recent health literacy conference. I believe it was their 5th, and they have been putting a lot of effort organization-wide into health literacy. And so I have borrowed from them, and I think they are a great resource for all of you, everyone around the state. And if this is a topic you are very interested in, I would suggest considering going to their health literacy conference next year. All right. So impacts. Why is it that health literacy is important? As I spent a little time looking over literature and studies, I found that there are a lot of different measurements of who is affected and how many individuals are affected by health literacy. So, you know, it varies from 1/3 to 1/2 of the population nationwide, but here are some statistics. So according to this one national survey, over 1/3 of the adult population has limited health literacy, which means that they have basic or below basic health literacy levels. So what that impacts is that limited health literacy is then associated with medication errors, increased healthcare costs, and inadequate knowledge and care for chronic health conditions. And this came from the Health Literacy Universal Precautions Toolkit, the 1st edition. Another set of impacts that I found came from the Minnesota Health Literacy Partnership website, another great resource. I'm not going to go on to their website, but it is linked as a resource on this presentation. And they state that half of all American adults, so 90 million people, experience difficulty understanding and using health information. And a few of the statistics they quoted on their website are that low health literacy increases our U.S. healthcare costs by $50 to $73 billion each year. As far as inpatient spending, someone with low health literacy was expected to have $993 higher cost than patients with adequate reading skills. And then Finally, those with low health literacy incur average healthcare costs of $13,000 per year compared to $3,000 for those with higher literacy levels. So those are some of the more population level impacts that can occur for individuals that have low health literacy. Generally, we think of lower health literacy rates. People with lower health literacy rates have increased causes of mortality across the board, poorer health overall. They often enter the healthcare system sicker. They have a much greater difficulty following medication instructions. They use less preventive services and generally have increased hospitalizations, clinic visits, and costs. Another interesting fact, and this will come down to something that you may think personally about, is that someone estimated in a study that about 40 to 80% of the medical information we hear in a visit with a provider is forgotten upon leaving the office. And that's everyone, not just those with low health literacy. And it's worse for those with low health literacy. And that half of what we retain when we leave an office, half of that information is incorrect. So the way we remember probably things like the medication we're supposed to take or the processes we're supposed to follow. So we just talked a little bit about the sort of population impacts, but I want you guys to take a moment and think about personal impacts. Health literacy is something that can impact anyone at any time, particularly if you have been to a visit with a provider where you may be receiving some difficult information. Maybe you've just been diagnosed with a chronic disease. It's hard to hear, and when that happens, we have a hard time taking in and processing and retaining the information that has been given to us. So I want you to take just a moment and think of a time that you saw a health professional and did not fully understand what they told you. And here's another chance for us to use our chat boxes. How did you feel after that visit when you didn't understand what you were being told? Kate, do you mind helping me look through responses?
Not at all. So again, questions, pane, chat box, either of those are available for you to weigh in on Claire's question on a personal example maybe someone's had. Someone shared confused and overwhelmed.
Yeah.
Thinking, you know, how could I not have understood what they just said, so maybe kind of embarrassed, or not wanting to admit that you didn't understand something.
Right.
Someone else shared that it was a lost chance, so, you know, now that you're done, like, you're not going to be able to get that information, and you kind of feel like you're never going to be able to get it. If I left not having asked questions for clarification, it's because I don't feel comfortable, you know, asking the provider due to their behavior or how the provider seems, so feeling intimidated or rushed.
Great.
Someone, you know, annoyed and frustrated that a provider doesn't empathize. Someone else shared that they're very aggressive with healthcare providers and have seen family members struggle with clarifying things, feeling embarrassed, overwhelmed, feeling not confident, questioning people.
So these are all amazing answers, and this is what I was hoping to get at. You know, we can see those the costs and the issues that health literacy has population-wise, but this is how it feels when you're having difficulty understanding and when you don't have the opportunity to ask questions. You know, my follow-up question here is, were you then able to do the things that your provider told you to do in that visit? And clearly, if you didn't have a chance to ask questions, you didn't feel like you understood what was going on, how are you going to be able to successfully follow up and do what you were asked to do by your health professional. I do want to take a moment and step back. So we often, when we talk about effective communication in a interaction in a healthcare visit, there's a few factors to think about. Health literacy is one of them. Then there's also the cultural competency piece. So is your provider someone that is relating to you, that is being empathetic, that you're able to communicate with? And that is a little bit out of the realm of health literacy, but it very much impacts the visit. And then there's also just the use of plain language, which again is something that some people lump into health literacy, but others sort of pull it out separately. And that is more, how clearly are you speaking? Are you using words that someone who doesn't work in the healthcare industry can understand? Do you have ways to express what certain things mean and not in our medical terminology way? So you do want to be thinking about some of those pieces as well, along with this health literacy piece, and just how are people taking in that information. A lot of it does have to do with the environment in which you're delivering it. Any other thoughts? Did people have any reactions to how, if they were able to successfully do the things they're asked to do within that visit? Kate, are there any comments to that?
Just one extra one, just feeling like these things make some people not even go back at all to their provider, or, you know.
Right.
That it can be more than this opportunity of that visit, but it can be a relationship altogether.
Definitely. So it will impact not just that particular visit, but the long-term relationship of a client and their provider. All right. Well, thank you for taking a moment to think about the personal impacts with me. Let's see. All right. So we talked a little bit about what health literacy is and what some of the impacts are. The next piece I want to talk about is how do you assess your organization as far as how well you address health literacy, and how do you assess clients as you work with them? So when talking about assessing your organization, there's three main questions that I have here for you to consider. So one is, do you have a systematic way to assess the written materials provided to clients? Have your staff been introduced to the concept of health literacy and how to address it? And do your staff feel equipped to communicate with a client who has low health literacy? So I would love to get a baseline understanding of where all of your organizations are at. So at this point, we actually have some polling questions, and we're going to find out the answers from each of you to each of these three questions. And the PCPCI folks are going to help me with this.
All right, so a poll will come up on your screen in just a moment here, and go ahead and indicate your answer to the question number 1. All right, we'll go ahead and share the results there.
All right. So it's about half and half from what I see here. I've slightly tipped towards the yeses, but so it's good to hear that some of you, this is not brand new and that you have a systematic way to assess these written materials. And then for those of you who say no, I will be sure to leave you with some resources for how to do so. Great. All right, how about the next question? So have you been introduced to this concept and how to address it? Great. So, so this is looking more, I can't actually see percentages, but I can look at these nice colored bars along with the rest of you. So it looks like the majority of you answered yes, probably about, not quite a half maybe, said that you have been introduced to health literacy before and how to address it. About half that number said no, and then a little less than that are not quite sure. Great. I am happy to hear that a number of you have been introduced to the concept. And then the very last question is, and this is sort of the important part of this, of course, is do you feel equipped to communicate with a client who has low health literacy? All right, great. Well, this is exciting. I'm happy to see that we have a lot of yeses here, a lot more yeses than nos, and some somewhats, and somewhat is also, again, better than a no. I guess I wouldn't have expected the results to be quite so high in feeling equipped if you haven't been haven't assessed your organization before on this, but probably a number of you working in the field, this is something you do sometimes naturally, and so you do feel equipped to work with individuals in this way. So great, thank you for sharing the results or your, where you think you're at in this understanding of health literacy. That gives me a great understanding, and thank you for interacting. So let's see, let's move ourselves forward. All right, here we go. So the first tool that I want to introduce to you is the Universal Precautions Toolkit. There was a quote from them earlier, and there's an initial, the first edition that came out back in, I believe it was 2000, and then there is a brand new second edition available now that came out in February of this year. And Universal Precautions is the name of this toolkit because what the recommendation here is that practices should assume that all patients and caregivers may have difficulty comprehending health information and should communicate in ways that anyone can understand. The studiers, AAHRQ, and folks who have done a lot of work in health literacy have discovered is that taking these precautions with everyone can't hurt. And it really improves outcomes for everyone. Even those who have higher health literacy can benefit from the effects of universal precautions. So one thing, oh, I've gone too far. How'd that happen? All right, sorry. Let me see. I want to try to get into this real quick and see if I can show you what this looks like. So here is what the page looks like. So the Universal Precautions Toolkit looks at 4 domains, and they are the spoken communication, written communication, self-management and empowerment, and supportive systems. And I love that they go beyond just spoken and written communication and really talk about self-management and empowerment as well as supportive systems, because those are things that we also know greatly enhance outcomes of clients and are very patient-centered. So let's see what to say. So the Universal Precautions Toolkit is something referenced by pretty much everyone I run across in the health literacy world, and there are a lot of tools within this toolkit, way more than I can even get into right now. But one tool that is in there that I do like is there's a checklist that you can use to do a quick health literacy assessment of your organization, and it is in these 4 domains of spoken communication, written communication, the self-management, and supportive systems. So it would be a great place to start if you want to do a more in-depth assessment of your organization. And from there, you can use a number of tools available to you to enhance those pieces afterwards. Now I need to try to figure out how to get back to our, let's see. Kate, how do I get back into the main presentation?
We'll get you back in there.
Okay.
In the meantime, I sent a chat message out with a link to that website, and then that'll also be linked at the end of the presentation too.
Great. So, all right, so the Universal Precautions Toolkit is one excellent resource. And I'm trying to move us to the next slide. Kate, I can't seem to move it to the next slide.
We'll go ahead and just move you forward one.
Great. All right. So after considering assessing your organization and how well you are equipped, then you can think about assessing health literacy within your patients. Now, I know the rule of thumb was to treat everyone the same and apply your precautions to everyone you treat. And when you recognize that you have patients that are very challenged with their health literacy, you may want to do additional things to help them out. So while you do want to apply your precautions to everyone, you're going to do a little more when you interact with folks that you have assessed as having low health literacy. Now, one tool that probably a number of you have seen and that I have been introduced to a number of times is called the Newest Vital Sign. And the Newest Vital Sign is a little test, a 6-question test that you can give to a client to find out how health literate they are. And this test also addresses numeracy because what you're doing is looking at, I'm going to go into this link if I can, you're looking at the nutrition facts on the back of an ice cream carton. So you hand that nutritional label to someone and then you ask some questions. So this tool has 2 pages of information about how to use it. And then I'm getting there, sorry. So then there's these 6 questions you'll ask, and then you score them. So those who only get 0 to 1 of them correct have lower literacy, 2 to 3 questions correct, limited literacy, and 4 to 6 correct, you tend to have adequate health literacy. So just for a sneak peek, this is the nutrition label that you will show a client, and then you ask your 6 questions and get a sense of what their health literacy level is. And Kate, can you take me back to the main presentation again? So the reason they call this the Newest Vital Sign is that the belief is that along with other vital signs like your height and weight and your blood pressure, that just as important to know, it's important to know those things, and it's just as important to know what someone's health literacy level is so that you can design your interventions and plan of action accordingly to the level of understanding of that individual. So that's why it's called the Newest Vital Sign. And I believe there's, I think the Winding Waters practice out in Enterprise and maybe a few others did they tried this out for a while where they actually did this Newest Vital Sign with all of the clients at the beginning of each interaction to assess, and I maybe we'll hear from them later on. I think they maybe were registered, if Kelly's on the line later, about how that went. A lot of clients sort of balk at the idea of having to take a test. I mean, maybe a lot of people generally don't like to be told they're given a test, and as soon as you're told it's a test, you do worse on it. So there are some ways to introduce this that are a little less intimidating, and it is something you can consider doing if you want to be able to assess your clients across the board when they come in, or maybe just individual clients that you're sensing are having a difficult time understanding information they're being given. So the other ways that you assess these health literacy levels in your patients are things you probably do regularly without even noticing it, but it's just your observations and questions that you ask of folks. Simple things like, often are they taking a really long time to fill out paperwork that you give them at the beginning of a visit? Or are they asking to have assistance from a family member when they have to fill out paperwork or answer questions? So there's your observations. Then there may be input from other staff and family that let you know that someone struggles with health literacy, and as well as maybe literacy generally. And then another important thing when you're in that interaction with a patient and telling them all kinds of information and getting no questions. The no questions being asked is a good indicator that there's not understanding, or that there's some other thing going on why that is prohibiting folks from asking questions. Sometimes it's a cultural thing, and some folks don't feel like they should ever ask questions of their provider. And sometimes it is that maybe you haven't created the space, or there really just is this lack of understanding to even know what questions they should be asking. So these are just some of the things you can use to help you understand where your clients may be at as far as their health literacy levels. All right. So now I would like to spend a little time talking about some of the tools and techniques to use when, one, working with staff, and then two, working with clients. So I am not going to go right now into the Community Health Partners website, but this is a great website that has a number of training exercises and videos listed on it. I think that the videos that demonstrate the concept of health literacy are very impactful, and if I had more time I would play some for you right now, but that is a great way to just introduce this idea to folks. And then there are a number of training exercises. One of them that Cassie Burns from Community Health Partners did with us was she took snippets of sort of an everyday process that folks have to go through, but we didn't have the context for what that process was, and we had to practice doing teach back with each other around the steps in that process until we got it right. And I'll tell you what, that exercise really hit home with me, because I am a person that needs context to understand what's going on. And when I had to try to remember all these steps in a process without that context, I found it very difficult to do. And it really made me think a little more about the people that we work with every day and try to depart this information to them when they don't have a context for it. So those are just some of the things that you can use to train your staff. The newest vital sign that I shared with you earlier is another great tool to just break out at one of your staff meetings when you're introducing this topic and have everyone go through that 6-question test and see how they rank on the newest vital sign. There's a lot of fun and creative ways to introduce health literacy to your staff, and I would recommend looking at this Community Health Partners website and that Universal Precautions Toolkit to come up with something that will work well for your organization. So, all right, so the next thing is to just, is tools and techniques that you can use with your clients to enhance communication. So this I stole from Legacy, borrowed. So they had this nice, they actually have some cards, little cards that you wear. What's the card? It was maybe a little business card, or it was on the back of their badges, and it had these 5 steps to better health literacy. So one is to speak slowly. If you are a native East Coaster like myself, you may be a fast talker, and that's something we all need to slow down a little bit. To use teachback. I don't have unfortunately, not tons of time today to get into teachback, but teachback is basically the process of ensuring understanding by asking an individual to tell you what they've learned, to teach it back to you. I've learned this many times with my children. If I say, do you understand? They say, yes, yes, I understand. But what you really need to ensure understanding is for them to tell you what it is that you need to do when you leave, or explain back to you what it is that you have told them. The next is to encourage questions, to use plain language, and to show examples. I was at a presentation during the Legacy Health Literacy Conference where the primary care practices were showing how they have enhanced their health literacy program, and one of the ways is that the provider has a whiteboard or a flip chart right there in the room and just draws pictures of things as they're going through it. As well, you can hand paper to your clients so they can take notes or write pictures, or you can draw pictures on that paper for them. So just thinking about ways to pull in some visuals to help with the explanations. So there's a lot to all of these 5 steps that I really can't get into right now in the time we have, but definitely all good things to be thinking about. Now, the teachback prompts that Legacy has are also very helpful. So teachback is something that can feel a little awkward if you don't regularly do it. And the way you phrase your questions to get that teachback is important. You want it to sound and feel authentic coming from you. And so these are just some prompts that you can consider using. You don't have to use them exactly as these are stated, but these are some good examples for you to consider. So I'll just go through them quickly. One is, I want to be sure that I explained your medication correctly. How are you going to take your medications when you get home? Another is that we covered a lot today. What are some of the things that you can do that will help control your diabetes? Show me how you're going to change your dressing when you get home. And I shared a lot of information today. Tell me how you're going to explain what you've learned to your spouse. So these are the how, what, show, and tell. Another thing of note is that beyond just having someone tell you what they're going to do, I think the showing is very important in any instance that you can. If someone can almost simulate what they're going to do when they get back home, that's even better than telling. It's the doing, which will really fully equip folks for when they get back to understand and remember what it is they should be doing. All right. One other area I wanted to share a little bit about that I took away as a big learning from the Legacy Health Literacy Conference was the UMS, the Universal Medication Schedule. So one of the areas that health literacy very clearly impacts is our ability to effectively take our medications. And when we think about folks that take 7 or 8 or more medications a day, and the types of instructions we give them, it's often pretty unclear. So the Universal Medication Schedule, there's some rules about how to express when people should take things. So you often say take 2 pills twice a day. Well, that isn't a whole lot of instruction. When we say 2 pills twice a day, do we mean what times of day? So when you're looking at these Universal Medication Schedule graphs and charts or visual displays, there are a number of ways to display it, but it's more explicit than the instructions we generally give that are written. And when we say take 2 pills a day, we need to be more explicit. Take 1 pill in the morning and take 1 pill in the evening. And here are the hours in the morning, and here are the hours that constitute the evening, so that it's pretty clear. Another way that you can share this information is to actually put it all out into a chart like this one, where it's not even the names of the pills, but the way they look, right? So a number of people, they don't even know what the medications are that they're taking, and they may know what they look like. And so if you have multiple medications you're taking over the course of the day, here is a visual display of how to do it and the exact times of day that you should be taking them. So there's different samples of how to use the universal medication schedule, but this is definitely something I would consider using as you move forward. It's not something that you can easily perhaps have programmed into your electronic health record, but it is something you could do outside of that and provide these explicit instructions to clients so that when they leave the office, they understand what it is they need to be doing about how to take prescription medications. I'm just checking the time here. You know, it's something a colleague of mine here at OPCA told me recently about how her husband, a very well-educated man, a smart man who has high health literacy levels, had been taking his medication wrong for years. It was 1 pill, and the instructions he was given, he didn't understand it, and he was taking it wrong, and it was not helping his condition. And so finally, upon going back to the doctor and considering whether they needed to adjust the medication, they realized that he hadn't even been taking it correctly. And so it can happen to anyone, and it's important to think about ways to effectively communicate, particularly in this area. I think this is an area that there's a lot of patient safety involved in this piece, along with improved outcomes. And when you can improve the way your medication instructions are delivered, that really directly can impact a lot of health outcomes pretty quickly, just by taking the medication the way that they should be. So there is one other test too that I mentioned, but I didn't have a slide for it, called the REALM, what is it, the REALM-A test. And that, I also have a link for that. But it is an assessment you can do with, sorry, I'm going to go back up one. It's an assessment you can do with folks who, it's geared towards older individuals and individuals that are taking a lot of medications. And it's a test of how well they will be able to understand their medications and how to take it. So the REALM-A is a way to do an assessment on that medication piece, and then consider how much time and energy you need to put into doing this prescription information with folks. And hopefully some of you have really great, robust medical home teams, and you have pharmacists on your teams that can take the time to really sit down and dig in on this medication piece with your clients, because that is definitely an effective way to ensure medications are being taken correctly. All right, well, those are the main samples that I have for you of some tools and techniques. There are a lot more available to you through some of the resources I have listed, and if you just go do a Google search out there, there's all kinds of resources for you. So you know, find those that work well for you. Some of them are evidence-based. The Universal Precautions Toolkit is all evidence-based interventions and techniques, and a great place to start. And then there's a lot more info out there as well. So the very last thing I like to do before we get to questions, and we have saved a little bit of time for that, is now that you have digested this sort of basic information and overview of health literacy, when you log off this webinar, will you do anything differently? And if you would like, you can take this last opportunity to either type in a response to this question or launch us right into any burning questions you may have about some of the content that I've covered today.
So again, people who have questions or thoughts or comments to share can enter them in the questions pane in the go-to webinar control panel. And some of the things that folks writing in now have shared is do additional research on vital signs and have our team take the quiz. Someone else shared, to do some training with staff and look at using the UMS. It looks like a really great tool. Someone else shared just realizing the importance of slowing down, asking the patients more questions to see if they understand things. Someone else shared that they attended the Legacy Health Literacy Conference, and this was a great review of things learned at that conference. So another, again, recommendation for that conference for when that rolls around next year. And someone else shared they really want to champion this within their organization to implement things more at the organizational level versus pieces being implemented here and there. So that's something that they're taking away and going to think about.
Excellent.
Yeah, so those are some of the thoughts. If anyone has any questions or ideas, maybe an experience they'd like to share, you can type those in, or if you want to be brave, you can raise your hand on the GoToWebinar, and I can unmute your phone line, and you can ask your question or share your observation directly. So we'll just give a few more moments for folks who have their questions to type them in, or any thoughts or comments you have on the discussion on health literacy today.
I'll share an experience I had shortly after going to, I think it was shortly after the Legacy Health Literacy Conference I was at, and I was in at my physical therapist's, and I had kind of done something bad to my knee, and she was telling me about some ways that I needed to tape it. If I wanted to play, I play soccer, and if I was going to go and play, I should tape my knee up in this special way. And I was like, okay, great. And she said, would you like me to show you how you should tape your knee? And I said, I think you should. And so she taped it up for me, and then I took some pictures of it. So, I almost dismissed it and said, oh no, I'll figure it out when the time comes. And then I remembered, what, when I walk out of here, I am not going to remember how I'm supposed to do this. So she did it for me, and I took pictures. That was my takeaway. And so when it did come time for me to tape up my knee, I could go look at those pictures and remember what it was I was supposed to do. So there's my little personal story for you.
One question that came in, Claire, are there any examples of folks who've used their EMRs to help with addressing health literacy? Or patient portals, maybe?
I think it depends in what area you're looking. I know a lot of people have been looking at their after-visit summaries and trying to make sure that instructions or information that gets printed out for clients is understandable and easy to process for that individual. And I think it's a tricky area to make those changes in. At the Legacy Health Literacy Conference, we had a presenter who was from California, where they actually passed, I believe they passed some legislation to require the universal medication schedule use. And so they got the policy passed, and then he spent the next year fighting with the EMR vendors to try to get some of that evidence-based information into that after-visit summary, and that was actually the hardest part of the process. So that's where I mentioned you may need to consider doing some things external to the EMR at first until they can be put into there. But there's definitely some folks that have looked at after-visit summaries And if you have specific areas that you're wondering about, then I'm happy to let you know if there's clinics that have been looking at those specific areas.
Yeah, one thing that I did share, it just reminded me that Wallace Medical Concern recently submitted a post to the Institute blog, and I just shared it, and it was about a project that they did to get patients with, low health literacy, but also just, who struggle to use technology, getting them engaged with their patient portal. So they came up with some good ideas, and I think worked with some students at Portland State to take a look at that. So I shared information from their recent blog post on the Institute website about what they did. One other person shared that, when patients are in the lab or working with medical assistants, they get a lot of questions, and they try and coach them to speak with the provider and share those questions when they're in the office. So that's one thing that people can do. Yeah. Although it's kind of hard, because then it feels like maybe patients are repeating themselves to people. So it seems like that communication could be systematized a little better between staff who may get the questions that maybe people feel more comfortable asking them than they do providers.
Yeah, definitely. You want to consider who the people are that are helping them understand information, and whoever the most appropriate person is should be equipped to do so.
Excellent. So we don't have any other questions. If you have one more that you want to get in, please type it in the next 2 seconds. I would say in the meantime, we'll go ahead and move the slides forward and share some of the links to the resources that Claire mentioned. Again, these slides will be posted on the Institute website, along with a recording of today's presentation. So you'll be able to review these links there, or share this webinar with colleagues who maybe couldn't join the webinar today. We want to thank Claire not only for sharing this wonderful information, but for braving the webcam for the entirety of her webinar presentation. This is the first time someone's gone all webcam for the whole webinar, so congratulations to Claire and her pioneering spirit. We hope that everyone will take the last few minutes before 9 a.m. to complete the post-webinar survey that pops up after you exit the webinar today. And we thank everyone for joining us.
Thank you.
Bye.